So hi, my name is Monse Amodeo. I'm one of the consultants at the Equal since 2018. I trained in Spain and I finished my training at Optum Gynae in 2013. And then I did fertility training in St. Bartholomew's Hospital in London on the NHS. And I became a fertility consultant at the Equal in 2019. And I've been part of the group since then. Some women on the late 30s, I've been diagnosed women with endometriosis on the late 30s are part of their fertility consultation. So they are coming with a partner or on their own, trying to get pregnant, just fertility preservation. They get scans, they tell you about the periods, and they have big endometriomas, they have ovaries that they're stuck into the uterus, and they were not aware. They've been feeling that it was normal, that they would have that pain with intercourse and that painful period. So. And most of the time it will be a part of an ultrasound, and then they will get it back. Most of them, they are not diagnosed before. It's not straightforward that they will get a referral to gynecologist to address the syndrome. We don't get told that much into those conditions. Those conditions creating an issue into the health system and needing to be treated more than the fertility problem that can cause. It's really important because I always tell my patients when they come and they say my periods are painful, but that's normal. I say, why is that normal? My periods are not painful. They've never been painful. Mm-hmm. Why yours will be normal and mine are also normal? So there is pain. So it makes you to miss work. It makes you to miss school, university. So it's heavy that you need to change every 2 hours. So it makes you anemic. So why that will be normal? You may have normalized that because it be happening to you, but it's not necessarily normal. It's obviously it's that message what we need to transmit, and it needs to come from mothers and future mothers that they will have girls that they need to also tell the girls. So speak out. So if it's painful, let me know. And at the same time, encouraging doctors to understand it's painful, and we need to trust this, and we need to understand this as a problem, and tackle that problem. And we are a lot more educated, and your generation is a lot more educated, and that needs to continue in that positive way. Mm-hmm. But we can see now every day that. From my generation to your generation, how women are taking control. As I say, we see coming to the clinic and having just checkups. I've been turning 28, 29, and coming to have just a fertility checkup, having scans, and that's really positive. I have parents taking their daughters for that. So they are like a mid-20s, and they take their daughters like, let's have this checkup, let's make sure that everything is fine. So we see it, and that's really positive. So we are more educated, and we are more proactively taking control.
So you have endometriosis.
I do.
And can you tell me when you were first diagnosed?
Well, I got the official diagnosis after my surgery, which was when I was 16. But I started to pursue a diagnosis about 9 months prior to the surgery.
So when were you first diagnosed with PCOS?
So I've only been diagnosed in the last couple months. Mm-hmm. But I've been dealing with it for at least 5 years.
I was diagnosed with PCOS, I think, when I was like 15.
Oh, I got diagnosed really late, when I was 18. So that's 3 years ago.
I got an ultrasound then and there, and they were like, oh, by the way, you have a 4.5 centimetre cyst. Like, did you know that? So in the last couple of months, I've been going to the GP more often. I've been referred to a gynecologist. I finally got an appointment. It's taken 5 years. As soon as they said, oh, you might have it, they started listing all these things that it would affect me and like how I'm seeing myself in the future. I was like, God, this is going to really mess up my life. And I was so upset for a good while. So they prescribed me on tranexamic acid, and they're quite big pills. I need to take 3 of them 3 times a day. That's to stop the blood flow a little bit, but it's not doing anything for the pain. Really annoying that a lot of us girls have to go through that, and we're criticised, and we shouldn't have to go through that.
When I would have to tell my mom I needed to stay home from school, she was like, something isn't right. And like watching my sister going through periods that were like, painful, but not anywhere close to what I was going through.
Do you have any mental symptoms?
Definitely like anxiety and like bouts of depression. But I also definitely have a lot of like health anxiety now. Mm-hmm. The doctor who performed my surgery, I was his patient for like 3 years after. It started to become not very helpful because I was still experiencing symptoms post-surgery. So, like, it just became kind of like a dead end. But I don't think the pain has ever been as bad as it was prior to surgery, but it's definitely, like, come back a little bit stronger since, which is why, like, we were pursuing the IUD option.
Has it been an easy thing for you to communicate your pain to your doctors? Have they believed you all the time, or do you find that it's been a little bit difficult?
I think a lot of doctors still don't really know what it is. It's more of like a systemic problem where, like, it's not their fault they're not being taught something that they're not aware of. It's the fault of the teaching section that this isn't being included as something to look out for. It's always hard. And I feel like also sometimes too, like, when you find a doctor, you sometimes even want to keep your guard up because you're like, are you just nodding your head, or do you actually understand what I'm saying? And, like, it can be hard to even, like, kind of let yourself believe that they believe you. So I think there's an element to, like, you know, like, if you break a bone, there's a very, like, easy process of healing. Where, like, with this, it's like a lifelong confusing process that's always going to be a little confusing and always is going to be kind of with you. I, like, so felt like my diagnosis was like a death sentence because I didn't understand. That's the other thing too. It manifests so differently in everybody's body that it is such an individual experience. Like, my symptoms and pain and all that is so different than what you have, and so it's a very hard thing to generalize. So I feel like it's just little things like that it's just like it's a never-ending, like, education battle.
I've always had abnormal periods, like 2 periods a month, basically, which I haven't always had, but I've always had abnormal periods. Because I was quite young, 14, 15, the doctor didn't really want to properly diagnose me and put me on medication. I couldn't take traditional birth control, traditional medication, because my mum had a blood clot, so I took, like, alternative medication, which is usually used to treat other things but can treat PCOS. I take metformin, which is supposed to be like an insulin medication. I also take spironolactone, which I didn't start with at the same time. And obviously, I think it is kind of strange that birth control is the first thing recommended, because the side effects are way worse on birth control than on the alternative medications. But I guess usually it's the most effective medication. And the PCOS, for instance, like, the fact that I have 2 periods a month, they're still unpredictable, whether it's, like, heavy or light. If you have 2 periods a month, then they're, like, usually 7 days each, you know what I mean? That's half your year you're on your period. That's going to affect you. You're basically cleansing your uterus when you have your period. You're like, maybe I'm misinformed, but, like, you're cycling your eggs, basically, and you have a limited amount of eggs in your life. Am I going to run out of eggs sooner than everyone else? And I think a lot of doctors in the UK, especially in private sector, I think, I don't know, dismiss a lot of what you're saying. And I've had that happen so many times. And especially when it's very out of your control. Like, it's very hard when something feels out of your control and you have no explanation for it. If you have an explanation, it feels much more, like, you feel less alone.
Were you educated about PCOS at all in school? No. Nobody talked about it, not even in sex ed class where they talked about periods. I didn't know. My mom didn't know. Yeah.
And is it frustrating, do you think, to try to explain to people?
It's like, when, for example, one time I remember I didn't have acne when I was 14, and then I came back to school the next year, and then I had huge acne flare up, and people were like, what's wrong with you? I went to boarding school, so I didn't know shit until I left that boarding school, like, and when I was of age, which is so late. Like, I'm an international student, but I've been here all my life. It's just the queues are too long. So I have to spend my own money with a private doctor because the wait is too long, so I can go and immediately get help if I wanted to. So yeah, it's a bit of a fucked system because the health here is super expensive. If, for example, a PCOS, it's a problem because you don't have regular periods. It's harder each year to get pregnant. So I'm like, wow, I'm like a ticking clock. Like, I probably won't have enough eggs. I'm like literally thinking maybe I should freeze my eggs before I'm like 30.
I just wanted to ask about kind of your monthly cycle, if when you're feeling kind of episodes of depression.
Oh yeah, today.
Yeah, like today. Is that something that takes off multiple days from your work?
Oh yeah, I definitely have overthinking thoughts. I literally was crying today because my mood fluctuates like crazy. And having irregular periods is weird in itself because then your body is not releasing all the toxins, so you just end up carrying a lot of it, and like your hormones are regulated. So I just feel weird sometimes, and I feel blue. Like that's kind of heavy on my body. Yeah, I definitely feel not normal most of the time. But yeah, there's nothing much I can do.
Well, so in the UK at the moment, people don't understand endometriosis as a thing. So for years and years, I had such painful periods that I'd collapse on the floor and be rushed to hospital. Some people just think, oh, it's just a painful period, but it's not, because it's not the physical, it's also mental. Like the toll it takes on you to get out of bed each day, before my period, after my period, even if I get one that month, I have to take paracetamol and drugs just to survive. Like I've had 4 ultrasounds in the last year alone, and like I've had this personal experience with a doctor who came up to me and was just like, it's not real. Like you are lying to me. The pain is not that bad. But like your pain's not a 10 out of 10. I'm like, and I think that's the thing about endo. No one recognises it. What am I doing? Why do I have to wake up every single day and feel like I'm the only person experiencing this pain? Because there's not a drug that you can take that specifically targets endo. It's like I have to take a mixture of loads and loads of different ones, or be prescribed. I think I was prescribed this pregnancy one because there's nothing else. I've tried everything else, and there's like 1, 2 endo doctors in the UK, and their waiting list is like 5 years, and that's what breaks my heart. Because how do you tell someone, hey, this is what you're going through? It is like, it's not normal. You have got something wrong with you, but you're going to be okay, because one day, fingers crossed, we will actually get some funding and education in the topic. I'm like, I'm scared that I'm never going to be able to have a baby.
Yeah.
Like, I know I'm only 21, I'm still really young, but it's the fact of like, I am scared for what my body will do, because I don't know. Doctors don't know. They'll literally have a look at your ovaries and be like, give me something. We'll just have to watch it until it gets that bad that we have to remove it. And it's weird talking about it out loud, because I've never sat down with anyone and talked about it. I feel like if people can't see it, they're like, it's not real. It's like, but how do you want to see it? You can't, it doesn't pick up on a scan. You can't physically measure my pain level. I think that's what breaks my heart, thinking that other people and other young girls going through this, and their doctors and their parents and their teachers are just saying, it's just periods. Like, this is what women have to go through. I don't have to go through anything.